looking at conception, about every 28 days, the female ovum is released into the fallopian tube, or ovum, another term for female egg. Anyone happen to know the life expectancy of an ovum by chance? Or take a guess? About 24 hours or about 1 day. The ovum and the sperm each contain 23 chromosomes, and when they are fused at the moment of conception, they combine then to have the 46 chromosomes as those two combine into one joined cell. Sperm survive or can survive about 6 days, but most are viable only for about 24 hours to 48 hours. So at the point of sexual intercourse and ejaculation, millions and millions of sperm are released into the vagina. Only about 200 or so will actually survive the journey into the fallopian tube. Only one sperm will actually penetrate the ovum's outer wall, resulting in fertilization. And that fusion of the sperm and the egg marks the beginning of development. Now, what I want you to do is to take kind of a quick look at, let's just say that the egg's life expectancy is about 24 hours. Sperm, in most cases, are viable for about 48 hours. Now, anyone want to take a shot at when conception is most likely to occur in terms of when intercourse takes place? Any ideas? Significant to understanding when that's most likely to happen. Most conceptions result from, and again there are exceptions, but most conceptions result from intercourse occurring on the day of ovulation or during the 2 days preceding. So it's a fairly short window. And again, sperm, can survive up to about 6 days. But most will occur on the day of ovulation or during the 2 days preceding. Because again, the life expectancy of the ovum can be as short as 12 hours, somewhere between 12 and 24 hours. However, sperm are still viable if intercourse occurs a couple of days before ovulation, still are capable again of penetrating and fertilizing the egg. So again, a fairly short window. Again, it's important to remember that only one sperm, even though it may be surrounded by numerous sperms, only one will actually penetrate and fertilize the egg. All right. What we want to do is to look at the stages of prenatal development. Obviously begins with conception. There are 3 stages. What we're going to do is simply highlight, I think, 3 or 4 key points that I want you to remember for test purposes. And again, in your reading of the textbook, it'll give you a lot more detail of what's occurring during each one of these stages, but I want to try to hit or highlight what tends to be most significant. The germinal stage is the first stage. It lasts from conception to about 2 weeks. Obviously, it begins at conception with the fertilized egg that occurs in the fallopian tubes. When the egg is fertilized, we often then refer to it as a zygote. That will then travel down the fallopian tube to the uterus. That travel will take several days. From your other courses in biology or other subjects that you may have already taken, as the zygote enters the uterus, it'll float around in the uterus, possibly for 2 to 3 days, and then what happens? Excellent. It will attach itself to the lining of the uterus, or embeds itself. We call it, you don't need to know it for test purposes, but we refer to that as implantation. And the main purpose for that, anyone happen to remember from previous courses? Anyone at all? It allows for nourishment from the mother's system. Now, from the point of conception through this 2-week period, probably the most important thing that is occurring, even as the zygote is traveling down the fallopian tube into the uterus, there is rapid cell division. And ultimately, that cell division is going to be the result of the development, obviously, of the embryo that will become the fetus, and most of the cell division early on will be the development of major organs. So again, the 3 things that's important to remember: time period, conception to 2 weeks. It embeds itself in the lining of the uterus and begins to draw nourishment from the mother. At this stage, development is fairly at a low risk for any type of birth defects during these first two weeks. So, 2 or 3 key things about the germinal stage. The second stage is the embryonic stage. Lasts from 2 to 8 weeks. Again, it is important to kind of be aware of the length of each stage because it'll be significant to some of our other discussion about not only prenatal development, but also about prenatal care. So it lasts from 2 to 8 weeks. It's a period of rapid change, significant growth, at the end of this stage, major body systems and organs will be developed. So first stage, germinal stage. Second stage, embryonic stage. The heart will be the first organ to begin to function. Again, we're just hitting some of the key high points of each one of the stages. Now, I'll put this back up here in just a second. Nothing that you need to write down. It's a little bit cloudy. Again, here's looking at the 3 stages. We've already taken a look at, here's the germinal stage, the conception, the first 2 weeks. What these are representing, and it's a little hard to read it on the slide there, this is kind of a dark blue, kind of a purplish color. What these are representing, the more bluish shaded area, is representing major abnormalities that can occur. And these are defects that are still occurring in the time period, but tend to be less severe. And what this is indicating is what areas of the developing embryo are affected by that. Now, you don't need to know specifics for the test. Here's referring to the central nervous system, the heart, upper limbs, eyes, lower limbs, teeth, and so forth. As you can tell, as I've already mentioned in the germinal stage, not a high risk for birth defects. Now, at what period is the developing embryo most at risk as you look at that slide? And I'm going to come back and ask you another critical question a little bit later. The embryonic stage, and particularly what time period. And again, this is showing periods in weeks above.
3 to 6 weeks?
Exactly, 3 to 6 weeks. Again, the beginning of that period, and to some extent, right on through that period, but most of it's occurring between 3 weeks and 6 weeks. So hang on to that. That's real important. So one thing you want to be sure, and this is one of the, I kind of starred this in your notes, because I think it's one of the most important characteristics of this stage, apart from, again, very rapid development, major changes, development of major organs, again, all of that significant. But I think what's most important to remember is that it is during this stage that the embryo is most vulnerable to environmental influences that can result in birth defects. Sometimes we talk about pregnancy in terms of trimesters. This would occur in which trimester then? First, exactly. So again, on the exam, if we were to ask, during what stage are birth defects at the greatest risk of occurring, obviously the answer would be either the embryonic stage or during the first trimester. And like I said, in a moment, that will even make more sense in terms of the significance of that. All right. Third stage, the fetal stage. Again, just 2 or 3 kind of key points to remember about this stage. One, it's the longest stage of development, lasts about 7 months, or represents the last 7 months. So again, germinal stage, first 2 weeks. Embryonic stage, from week 2 to week 8. And then the fetal stage, the last 7 months. Probably what's most significant about this stage, obviously, is continued rapid growth. And again, I'm not going to ask you numbers on the exam. If you need to know the specifics at some point in time, you could look that up in any human development textbook. But around 4 months, we're looking at now referred to as a fetus that only is about 8 to 10 inches long and weighs anywhere from 6 to 8 ounces. Now that's at 4 months. And will gain more than 5 pounds and grow 7 inches in the last 3 months. So you can begin to see the significant growth and change over a relatively short period of time, even from the 4th month to the end of this stage. It's during this stage that the fetus will develop regular intervals of sleep, will actually cry. It's known to suck his or her thumb, responds to voices, and the mother likely will begin to experience movement. Now what's interesting, and we'll talk more about this as we look at characteristics of newborns, is that the fetus will develop regular intervals of sleep. However, those regular intervals of sleep may not correspond with the female's intervals of sleep. Anybody know why? Some have had the experience. When is the child most likely going to sleep? When you're active. So the child, it's not uncommon to go through intervals of sleep and wake, more sleep during the day. And part of that has to do with, as the mother or the prospective mother is active, she often is doing what in her activity of whatever she's doing? Moving. And that movement, in a sense, causes or kind of rocks the fetus to sleep. And so when is the fetus most likely to be the most active and awake? At night, when the mother would like to be sleeping, trying to catch up on her rest and rejuvenate her energy level. And so often those intervals are at opposites until that gets re-regulated after birth. So fetus will develop, again, regular intervals of sleep, begins to experience responses to their environment, will cry, suck their thumb, move, very definitely respond to voices. The age of viability, depending upon who you talk to, you'll get some variation, but most often is cited somewhere between 22 to 26 weeks. And the age of viability simply means, what are we referring to?
Is that
When they could live outside the womb, exactly. Or at least have a possibility of that. Obviously, at 22 weeks, there clearly are some risks involved with that. All right. Again, for test purposes, you want to simply be familiar with the 3 stages. And as you're preparing and reviewing your notes, kind of look over those, again, just 2 or 3 key points that fall underneath each one of those. Now, what we want to do is to simply take a look at what I kind of refer to in simple terms as the do's and don'ts of pregnancy. Now, what's our goal during this stage? And I know this seems probably overly obvious. Exactly. And what do we want? We want to nurture the development of this baby that's inside of the female so that it's healthy. You know, we want to optimize that the child has a good start into life and that it's as healthy as possible. And so what we want to do is look at what are those behaviors that are going to optimize healthy development. And then what are those behaviors that put that developing fetus at risk for that healthy development. That's kind of what we want to look at. So in terms of the do's of pregnancy, these are a lot of common sense, but again, it's amazing how we can know and at the same time not necessarily always practice some of these behaviors. Number one, early and consistent prenatal care. And everything else that we're going to be talking about are aspects of that prenatal care. Now, this may seem like a trick question. Think before you answer. When should prenatal care begin? Now, you know the answer to this based on what we've already talked about. When does prenatal care need to begin? Both in terms of the do's and even more importantly in terms of the don'ts that we'll be talking about. Prior to conception, exactly. What do you think tends to be the most common answer to that question? If we hadn't already covered the stages of prenatal development, if I asked just a general group of individuals, what do you think their first instinctively reaction is? When to start prenatal care? When you know you're pregnant. A lot of times what people think of is that you're going to start prenatal care as soon as you know you're pregnant. Now, based on what you already know, what's the problem with that? A lot of times people don't plan on getting pregnant, and add to that. Exactly. They may have already been practicing behaviors or lifestyles that could be harmful to developing fetus long before they know what? That they're pregnant. Because when is the fetus most, or the developing fetus, or at that point embryo most vulnerable? Particularly 3 to 6 weeks, 3 to 8 weeks, of which it's not uncommon for someone not to be aware that they're pregnant until after that point. And we know some rare situations where people may be 3-4 months into their pregnancy before they're really aware that they're pregnant, of which then lifestyle or choices and decisions we made could already have had a negative effect on the developing child. Now I have people say sometimes, well, how do you know? Well, it's really a pretty simple answer. If you are definitely planning, and intentionally wanting to get pregnant, then at that point you want to become aware of prenatal care. And particularly in terms of being aware of those high-risk kinds of behaviors. Or if you're sexually active, and not practicing any kind of effective protection against pregnancy, then there's a high probability that within 6 months you'll get pregnant. So if there is the plan to get pregnant or the possibility of being pregnant, that's when we want to begin prenatal care. Because again, if we wait till we find out we're pregnant to begin to do some of these things, then we're not optimizing the child's chance of having a healthy start. And that's clearly what we want to do. Now, the rest of these, again, are very common sense. Want to maintain a well-balanced diet. Now, I throw out a few other kinds of general information. You don't need to necessarily take them in your notes. But typically what we're looking at for a female is probably an increase in calories of somewhere between 300-500, someone there. Probably recommended, there's great variation depending upon the female frame, those kinds of things. But we're usually looking at somewhere recommended 25 to 30 pounds of weight gain. Clearly and there'll be some that will gain a whole lot more than that, and there'll be some that'll gain less. But particularly if you're looking at something less than 15 pounds or something, that could create some serious complications possibly. So we're looking at maintain a well-balanced diet. What is it not a time to do? And I think this is probably most important in terms of diet. lose weight or diet for the purposes of losing weight or avoiding to gain weight. Who might be inclined to do that?
People who don't want other people to know they're pregnant.
Yeah, clearly one. And again, you don't want to be stereotypical, but possibly a young teenager, who's not wanting someone else to know they're pregnant, may attempt to minimize or avoid gaining weight, and may actually go on a weight reduction diet, or even to some extent almost kind of a starvation diet to avoid gaining weight. What's the reality if she does that? What's occurring with the developing fetus?
The baby's taking nutrients from you, so you're going to be starving the baby.
Exactly, starving or at least malnourishing the baby, and that's going to affect organ development, particularly the brain, and so that is going to have an effect. Someone else not intentionally might try to avoid gaining weight so they don't have as much weight to lose after the pregnancy. And again, if the developing child is not getting the right nourishment that they need, it will affect development. So again, the key is, well-balanced, diet is the best kind of strategy. Another recommendation, maybe not necessarily going to have a tremendous effect on the child's development, but clearly has a number of positives, is moderate exercise. In most cases, females can maintain their pre-pregnancy level of exercise. May have to reduce, depending upon what their exercise regime is, may have to reduce that some in the later stages of the pregnancy, but typically can maintain whatever they've been doing, even if it's fairly high intense during at least the first trimester or so. The key is clearly for the female to listen to her body. Her body will pretty much tell her when she's beginning to overdo it. And may need to back off some from that. A general recommendation is to keep heart rate, under 140, 150 during this period of time, and then begin to reduce intensity in the later stages. And my experience, both in terms of my wife, but just other females that I've known, as you get towards the very end, life pretty much slows you down in and of itself, just in terms of your comfort level with that. It's probably not the time, if you haven't already been involved in that, to start doing cross-country running, start up kickboxing, or high-intensity aerobics. Aerobics may be fine, but if you haven't been used to high-intensity aerobics, you may want something that that's a lower level. What would be, real quickly, some benefits of exercise? There clearly are a number of just basic benefits and why it's recommended, even if it's nothing more than a daily walk. Anybody think?
It keeps you healthier.
One, it just keeps you generally healthier. Someone add to that in some of the ways in which it can keep you healthier. Any thoughts?
Actually, increased blood flow.
Mm-hmm.
It increases your heart rate, so there's increased blood flow to you and the baby.
Okay, excellent. Increased blood flow. It's going to benefit both of you. What else? Think about exercise in general.
It gives you a more positive and happier attitude.
Yeah.
Affects your-
Yeah, it's going to affect your general outlook. And why might that be important to some females? Not necessarily to all going through pregnancy, but some females at the point of becoming pregnant struggle some with self-image kinds of issues. And so one of the things it can do is, again, help you continue to feel good about yourself. Like exercise in general, it can help moderate stress, give you energy, particularly when energy is being zapped pretty quickly in your life, and just general sense of well-being. It's been documented that regular exercise makes delivery easier. Now, that's the operative word, easier, not easy, but it can. It also makes it easier in terms of maintaining a certain level of fitness and tone. So returning back to pre-pregnancy weight and shape and toning is a lot easier. So again, moderate exercise is recommended. This one probably not a big surprise, but get adequate rest. One of the things, my wife is a high energy individual. Is on the go 90 to nothing almost from morning to end. Now, she also requires 8 hours of sleep. But between those 8 hours of sleep, she hardly ever stops. And I remember when she was pregnant with our son, numerous times about middle of the afternoon, she would just look at me and she says, I just don't understand why I'm so tired. I'm just normally not this tired. Now, she went a long time before she really began to show dramatically and never got overly large. So for a long time, physically she didn't necessarily look, pregnant. And so she just kept the pace that she was going. And I had to kind of keep reinforcing her, you're pregnant. Your body's going through numerous changes, even though you may not necessarily be aware of it. Now, there was one way she was aware that she was pregnant. She had morning sickness. Morning sickness tends for some women have very mild morning sickness. Typically subsides, within about 12 weeks. For those that have gone through pregnancy, I don't know what your experience was, but I remember after the 16th week not to mention it again, because my wife was one of those unusual individuals that had morning sickness for literally 9 months. She did not feel well until the day after Matthew was born. I kept saying for the first 12 weeks, it's going to get better, it's going to be okay soon. And like I said, about 16 weeks, I quit mentioning that because it didn't appear it was going to get better, and it didn't. But it was hard for her because she wasn't, other than the physical aspect of the nausea. It was hard for her to realize that her body was going through dramatic changes, and it was taking energy. And she was tired, and it was hard to get her to stop and say it's okay. It's okay to get extra rest. You need it, during this period. And it's only going to be more the case as you move further into the pregnancy. So adequate rest is real important. One of the ones and there's more and more stuff that's coming out today, and I think we're going to continue to see more literature on this in the coming years, is the significance of managing stress. And what we're finding is, and again, it's not conclusive evidence, but it's clearly a growing body of evidence to suggest that the stress level that the female is under during her pregnancy can actually impact the outcome of the newborn baby. And what we're finding is there seems to be some indication, literally, that not only, as we know, hormone levels and different things change as a result of stress, that we know that some newborns seem to indicate more irritability, more behaviors indicative of hyperactivity, and that we're also seeing some indications of some medical conditions that can be impacted, possibly related to some degree to high stress levels. And so more and more we're encouraging during this pregnancy, do whatever you can, keep stress levels under control, lower levels of stress, do what you need to do to manage that stress, because it may very well have a significant impact. One of the questions that often comes up, I don't know that I would say it's necessarily a do. It clearly doesn't fall into the category of don't. But a lot of times people ask, can you continue to have sexual intercourse during pregnancy? And basically the answer to that is yes. Unless there are some type of complications, i.e. if the female begins to spot or has vaginal bleeding, then the doctor may recommend abstaining from having sexual intercourse. My wife and I had what was considered a high-risk pregnancy, and there was some fear during most of the 9 months about losing the child because there was some spotting, and so there may be some limitations as a result of that. This may seem like a strange question, but can you think of we've talked about benefits of exercise. This may be one that nobody wants to comment on, but can you think of any benefits of sexual intercourse during pregnancy? And there actually are several. And again, I know we're talking about that taboo subject, sex, so no one will probably want to comment. Yeah?
Maybe I think that sex draws you close to your partner or whatever, so maybe that is a way to make them feel more connected in the pregnancy.
Excellent. Yeah, one of the things it can do is, again, help maintain a good relationship with your partner, and again, helping your partner feel more connected to the whole experience of the pregnancy, and possibly be more connected at the point of birth. Also, much more likely, again, if his needs continue to be met, maybe more invested, more involved, more supportive during the pregnancy period. But also, one of the things that we know, both in terms of moving through the pregnancy, but also for couples as they make the transition, which we'll talk more about later on in the semester, to parenthood. a strong couple relationship is an important factor to where not only the pregnancy is more stressful, but that initial transition can buffer some of the stress and changes that couples will go through. So clearly that is very, very important. Can anybody think of another reason?
Emotional well-being.
Exactly. Emotional well-being. And then there's one other we joke a lot about it, but is significant towards the end of the pregnancy period. And there's no reason why you would necessarily know this. Yes, to induce pregnancy, actually. There's evidently some things that begin to occur if the female experiences orgasms during that later stage, actually can help induce labor. And so, if you're finally tired of being pregnant, wanting to move it along, then there may be an incentive to have sexual relations towards the end of pregnancy. So again, just some basic do's. Early, consistent prenatal care. Well-balanced diet, moderate exercise, adequate rest, managing stress are the keys. Now, a lot of times what we focus on when we talk about, again, prenatal care is a lot of focus on what we often refer to as the don'ts. And often what we refer to, and we're not going to look at all of them, we're just simply going to look at what would be considered some of the most common ones, are the teratogens. These are simply substances which may adversely affect the normal growth and development of the fetus. Now, just in general, it's recommended that the female, and in some cases even the male, consult a doctor when it comes to taking any type of medication or drug. Again, we're looking at what would be considered some of the most common, teratogens or substances, and these you're all familiar with. But there are other, and they could be normal medications that the female had been taking that may have an effect. I had a student one semester and was talking about, and I don't remember what the drug was. It was simply a medication that she took for some condition that she had, and she continued. The doctor said they didn't think it would have any effect on the pregnancy, and so she took it during her first pregnancy, and didn't during the following pregnancy. And she, at least from her own experiences, could tell some differences in children's behavior that they did begin to believe was linked to the medication that she was taking. And so sometimes we don't know what impact. And in many cases, unless it's absolutely necessary for health reasons, may very well be encouraged not to take anything during the pregnancy, period of time. It was an issue for us in the sense that my wife has chronic asthma, and there was questions about certain medications that she takes daily and what effect that would have. And later on, I'm going to talk about one of the effects that we don't know if it had on prenatal development. We sure know it had an early effect during the first few weeks of Matthew's life in terms of his behavior and his activity level as a result of some of her asthma medicine. And the other, we don't know whether it had any effect or not. We often focus again on the behaviors and lifestyles of the female. I think it is important that there's a growing body of literature that would suggest that males can have defective sperm based on their lifestyle as well. And I think we're going to continue to see that body of literature, grow. So it's not just the responsibility of the female, but likewise the male in terms of, again, the prenatal care, and particularly in relationship to these teratogens. All right, with that, let's take a look at what would be considered probably the most common. The single most common is smoking. And again, these are things that I think our society is very much aware of. I think females are aware of in terms of what choices couples may make in regards to these, vary greatly. But like I said, smoking probably is the most common teratogen. Research, pretty strong body would suggest that there are, and I put these in terms of potential increased risk. There's nothing to support the fact that in every case these behaviors will result in negative outcomes. But what we do know is that there clearly is an increased risk that there could be some of these outcomes. Smoking causes a decrease in oxygen flow and causes blood vessels to constrict. And that affects blood pressure and heart rate. And again, we know particularly early on, particularly with developing embryo and fetus, that's vulnerable and doesn't have fully developed organs at this point, is going to be more vulnerable to any of those kinds of changes. Clearly, we might want to put a star by this one. The most noted impact is, and again, increased risk of miscarriage and particularly low birth weight. And again, remember what our goal is optimum development, healthy child. We want the child to have the very best start they can have. Life is challenging enough in and of itself to have additional challenges from the start. So increased risk of miscarriage and low birth weight. There's also an increased risk of slowed growth, particularly during the early following stages that we'll be talking about. We find that there's an association, again, not necessarily cause and effect, but again, there's a likelihood that, again, the decrease in oxygen flow, restriction of blood vessels could affect, again, brain development to some extent. The severity of that is hard to predict or to know, but we do see an association with increased risk of academic and behavioral problems. I've had other students in my class talk about, again, particularly where that's been behaviors, seeing differences in their children, which would be related to academic performance in terms of, again, tending to be somewhat more hyperactive and more difficulty in terms of focusing, more easily distracted. Now, that could be influence caused by a number of factors, but we do see some evidence to support that smoking clearly could be at least one of those factors. And may contribute to acute and chronic respiratory illnesses, particularly asthma and other related breathing difficulties. And again, I think that makes somewhat logical or common sense. And again, I've had numerous students over the years who have commented on that and in terms of some of their own experiences and challenges. Now again, many children experience difficulty with asthma. My son has a mild case of asthma and clearly is not related to smoking. May have a genetic predisposition to my wife's chronic asthma. So again, it doesn't mean that if a child has respiratory difficulties or asthma that it necessarily was caused as a result of someone who was smoking. I think some of the research that's coming out now that I think is interesting, and again, it's not anything that would be considered conclusive, is the fact that not only smoking, the intaking, but secondhand smoke may be equally, if not more so, hazardous to development. And again, very inconclusive, but a growing research in that particular area. So again, most common smoking. Second one that we often talk about clearly has the potential again for some very serious complications in development is the use of alcohol. Alcohol crosses the placenta, causing fetal alcohol blood levels to equal that of the mother's. And so in a sense, when the female or the mother drinks, in a sense, it's like having that child likewise ingesting alcohol as well, and simply doesn't have the developed system to process that in the same way. And again, you'll see situations or cases where females have drank fairly heavily and seem to have no negative outcome whatsoever. Others who have drank very little and have an effect. I had a student actually not a student, I had a speaker, a nurse, a number of years ago came to one of my classes to talk about prenatal development. And she was talking about one of her own experiences. And this was many, many years ago. And it was before we knew a whole lot about the effects of alcohol. I'll put this one up because it's related to that. We often think of the fetal alcohol syndrome, and then there's also fetal alcohol effect, which is a less severe outcome of alcohol. But when she was speaking to our class, and she was citing an experience she had, and she was talking about, and again, like I said, this was many years ago, and and she was looking back and reflecting. And she had gone to a conference. In the conference, and she was a nurse, and the conference was on fetal alcohol syndrome. And she hadn't thought a whole lot about it. And again, this was information that would have been relatively new at this period. Like I said, this is probably 20 years ago. And as she was listening and participating in the conference, it was like lights began to kind of go on in her head. And she had a child, that exemplified some of the common behaviors of the use of alcohol. And not severe, very, very, very mild. But she began to think about, now, how could that possibly be? And then she began to think back in terms of her pregnancy. And there was a period of time, again, very early in her pregnancy, actually before she even knew she was pregnant. Again, going back to what we were talking about before in terms of when should prenatal care begin, before she knew she was pregnant, her husband was interviewing for a position. I guess it was a fairly high-level position for a company. I've never had any interviews like this, but I guess and she had gone with him on some of the trips and interviews, and that they had some receptions as a part of the interview process, and that there was kind of a cocktail hour, and that she had consumed very little alcohol, but had consumed some. And she began to make the connection that there was the possibility that even though it wasn't a lot and that she was not a drinker per se, that the alcohol that she had consumed may have been enough in her case to have had some effect on her child's outcome. And that she had made the connection that some of those behaviors or mannerisms were, again, characteristic of what she was then learning about, again, fetal alcohol syndrome or fetal alcohol effect. It can cause facial and bodily malformations. Again, this would be more characteristic of the syndrome, more so than the effect. Small head, wildly shaped eyes are what's most characteristic. Increased risk of low birth weight and failure to thrive. Again, common risk factor there. We do see that some children, particularly again in the more severe cases, shows growth deficiency. They tend to be thinner, short, and we see differences in brain development in smaller brains. So again, can have an effect, which then can delay growth not only at this stage, but slow growth in terms of the following earlier stages of the child's development. And finally, probably the more severe, and again, if you think about the impact that the alcohol can have, particularly on a young embryo's developing system, increased risk of neurological problems. And this can range anywhere from ADD, attention deficit disorder, hyperactivity, to a variety of learning disabilities, to up to severe retardation. Impact other behavioral problems or other behavioral issues such as irritability, hyperactivity levels, as well. And again, these are behaviors, these are preventable, and again, smoking probably has considerably less severe effects. Alcohol in its more severe form can have major effects, particularly when the result is, again, neurological damage that sets a challenge for this child for the rest of their lives. And again, clearly something that is preventable. The recommendation still, again, I know there have been some studies that have been done in Europe, that would suggest, again, particularly a culture where some alcohol consumption, wine is kind of a regular part of meals, that would suggest that there may be some positive outcomes of consuming certain alcohol. Again, I would suggest that is still somewhat questionable, in terms of that, and that there are some other benefits to the consumption of, say, wine in very much moderation. I think what most professionals would say at this point, that the recommendation is, because we simply at this point don't know, is not to consume alcohol at any level. Because everyone's system is different, and who knows how much is too much or not enough to have an effect. The risks are too great to take for something that we clearly can control, and that those negative outcomes are preventable with that. So again, for our purposes, the recommendation is none during this period or during this stage. we will look at the next time we meet. We don't have time today to really get too far into this one, but is to take a look at, and a lot of stuff comes out in the media, and a good bit of research is continuing to grow in the area of looking at what we refer to as the illicit drugs, particularly cocaine and heroin, and what we want to do is to take a look at what the impact of this is. Has anyone, and again we'll talk about this in the next time that we meet, anyone actually had, maybe in some work that you've done, or any personal kinds of experience, not your own, but those that you've known, that have had some reference to babies who have been born to either a mother that used cocaine or heroin? I had a nursing student one semester that actually worked on a unit that were substance abuse babies. And he was able to talk a lot about his experience and what some of the outcomes were. And I've had a couple of students who have either taken initially as foster parents and then adopted children, again, whose biological mother had abused some form of drug. And we'll talk some about those kinds of experiences. Anyone happen to have any reference to that at all?
Yeah. I used to help my sister at a daycare center, and there were several little babies that were, not even a year old, and they were very nervous all the time, and they would cry, and you just could not comfort them.
Yeah. Hang on to that, and we'll talk some about that in our next session and draw on some of that, because those are some of the common experiences, both of the child, but of those who are trying to provide care for the child. She was talking about working in a daycare center, and there's a number of centers who part of their role is to work with children that have special challenges, particularly again the result of substance abuse. And so we'll look at cocaine and heroin, and then we'll move on and then take a look at some of the characteristics of a newborn.